Welcome to a modern medical overview of the human skull. The skull is a remarkable structure, serving as the bony armor for our brain and the foundation for our facial features. It's divided into two main regions: the neurocranium, which consists of 8 bones that encase and protect the brain, and the viscerocranium, made up of 14 bones forming the facial skeleton. Beyond protection, the cranium provides important sites for muscle attachment, enabling facial expressions and chewing. Understanding the skull's architecture is essential for grasping how our head functions, from movement to sensation. Let's explore its regions, bones, and clinical significance in detail. Bones of the neurocranium are classified as either paired or unpaired. The frontal bone forms the forehead and houses the frontal sinuses, while the paired parietal bones create the vault walls, meeting at the sagittal suture to protect the cerebral cortex. The temporal bones, also paired, are crucial for hearing and balance, containing the inner ear structures and external auditory meatus. The occipital bone forms the base of the skull, featuring the foramen magnum for the spinal cord. The sphenoid bone, known as the keystone, connects with all cranial bones and houses the pituitary gland. Finally, the ethmoid bone forms the nasal cavity's roof and supports the olfactory nerves. Each bone plays a unique role in cranial integrity and function. Cranial sutures are the fibrous joints connecting skull bones. The coronal, sagittal, and lambdid sutures are the most prominent, allowing for slight movement and growth during development. In infants, fontanelles, often called soft spots, are anossified membranes that permit the skull to flex during birth and accommodate rapid brain growth. The anterior fontanelle is the largest and closes by 18-24 months, while the posterior closes by 2-3 months. These features are essential for normal skull and brain development. As we age, sutures fuse, providing rigidity and protection. Understanding these connections is vital for recognizing developmental and clinical conditions. Skull structure has direct clinical implications. The Tyrian junction, where the frontal, parietal, temporal, and sphenoid bones meet, is the thinnest part of the skull and highly vulnerable to trauma. Injury here can damage the middle meningeal artery, leading to epidural hematoma. Skull foramina serve as gateways for nerves and vessels, such as the optic canal for the optic nerve and the foramen magnum for the spinal cord. Skull fractures can present with signs like raccoon eyes, Battle's sign, or cerebrospinal fluid leaks. In infants, premature suture fusion, craniosynostosis, can alter skull shape and brain growth. Recognizing these features is crucial for diagnosis and treatment in medical practice. Summary: the human skull is a complex, protective structure composed of multiple bones, sutures, and specialized features. It not only safeguards the brain but also supports sensory functions, muscle attachment, and facial structure. Key clinical points include the importance of sutures and fontanelles in development, the vulnerability of the Tyrian, and the significance of skull foramina for nerve and vessel passage. Recognizing fracture types and their signs is essential for timely intervention. The skull truly is the brain's first line of defense, blending form and function in remarkable ways. For further study, always refer to detailed anatomical resources.